Hello everybody, sorry for the late start. We were having some technical difficulties, but I just logged in from my phone. Welcome to Audio Help Hearing Center's monthly Facebook Live events. Today we're going to be discussing how the pandemic has affected communication, speech, and hearing. And hopefully I can give you all some helpful tips with that, since I know we're all struggling a bit with the masks and social distancing and protective barriers. While they definitely keep us safe, they are impactful, oftentimes in a negative way for those with hearing loss. So we're gonna dive into a few different things today. So first of all, face masks do lower the volume of a person's speech and they slightly garble it. I'm sure many of you can agree. Depending on the type of face mask that is used, they may reduce the clarity of the speech anywhere from 5 to 15 decibels. So that's a lot for somebody who already has a hearing loss of over 15 decibels. Speech is not just quieter, it's less clear. So it's not just the volume, but it's the clarity that it's affecting as well. So communication is made more challenging now with the social distancing of 6 feet apart guidelines and barriers, plastic protective barriers in doctors' offices and at restaurants. They further muffle and reduce the sound. Face mask ear loops, okay, the ones that go behind the ear, may tug on your hearing aids, and that causes problems. Or even with glasses as well, it's cumbersome. You can't rely on lip reading cues and other facial movements that help you understand speech and emotion when you're wearing a mask. Marlene Stager is watching. Hi, Ms. Stager. Just wanted to say hi. Thank you for joining. And for those of my patients out there who are not able to join, this is going to be recorded and posted to our Facebook page after if you want to tune in later on. So tell your friends and family. So I want to talk a little bit about which type of mask muffles speech the least. So we all know the issues that we face when wearing masks. So what can we do to help them? So the trick is, and I wrote a little bit of something, so sorry if I'm looking the other direction, but I am talking at you. The trick is selecting a mask that doesn't dampen your voice too much, protects you from the coronavirus, and if you have a hearing loss, works well with your hearing aids or your cochlear implants. But that's a lot for one mask to provide. So research has shown that sound-wise, the single-use surgical masks, the blue ones, okay, and the KN95s, those, the respirators, those dampen the sound only a little, about 5 decibels, and they can filter out small particles. So this is the way to go sound-wise. Cloth masks provide less protection from viral particles, but they do perform the best acoustically, the researchers noted. So let me actually go into my bag. I have a cloth mask that I do wear sometimes outside of work. So that would be something, like this. So while they're maybe not the most protective from the viral particles, so that's definitely something to note, they do perform the best acoustically. Interestingly, face masks with clear plastic windows, like so, which we wear here in the office for a lot of our hearing impaired patients. This is recommended for communicating with people who rely on lip reading, and they reduce the volume of the speaker's voice the most. So that was an interesting fact. So this seems to be the safest and the least impactful or least negative effects of reducing sound. This is the best though, acoustically, but not technically the safest. And while these do help with lip reading, they are not the best with helping the sound not be muffled or reduced. So the upshot of all of this is it's now a universal experience. I mean, maybe it's not an upshot, but the worldwide impact of COVID means these changes and their resulting challenges are universal. So by now, nearly all of us, even those of us with normal hearing like myself, have had to ask a person with a mask to repeat themselves or speak up. So hopefully people out there are a little bit more empathetic of those with hearing loss and communicating with them with masks, because even those without hearing loss are also struggling. So if you do have a hearing loss, asking someone to just speak up may not help. So louder speech bordering on shouting can actually hurt your ears and is oftentimes uncomfortable due to a phenomenon known as loudness recruitment, which happens due to damage to your inner hair cells that causes a permanent hearing loss. So actually a louder signal, louder sound, louder speech, it's not always clear, it's actually sometimes painful. So instead, you should adjust your hearing needs and use other best practices for communicating. So we're gonna go over a few of those right now. First, we offer here at Audio Help a face mask mode on hearing aids. So please, if you haven't already, talk to your audiologist about this, because it's different for every patient and it's different for every hearing aid, but we can actually add a program that is specifically meant for wearing face masks and, you know, optimizing speech communication while wearing masks. So if you wear hearing aids, you may be able to adjust them to account for the effects of masks on speech. Several manufacturers have issued updated settings known as face mask mode that you can control via your smartphone's device, an app on your phone if your hearing aid does connect with one, or with a button on the back of the hearing aid oftentimes, or with a remote control. And if you're not sure how to adjust your hearing aids yourself, don't worry. We can adjust them to account for how the speech volume and the clarity is affected by people wearing masks. So even if you don't have that specific program, come on in, make an appointment, and we can work that out for you. So some tips for wearing hearing aids with a face mask. If you wear behind the ear hearing aids, you may encounter problems trying to wear a standard face mask with the elastic ear loops. The loops may tug at the wire that goes in your ear or the tube that goes from the body of the hearing aid down to your ear. So you also may inadvertently pull your hearing aids out and lose them when you're removing your mask. If this sounds familiar, you are not alone. So what is a hearing aid wearer to do? Fabric ties may work better as they're adjustable and they don't tug as much as elastic ear loops. Mask holders or extenders can relieve your ears from the double duty of holding up your face mask. Sometimes, you know, face mask hearing aids, sometimes triple duty, face mask hearing aids, eyeglasses, headbands. So we give out mask holders or extenders at our office, so feel free to ask, come on in, and we can give you a few. Some masks clasp at the neck instead of the ears, so that's also very helpful. So it goes behind the back of your head rather than behind the ears. And of course, always remove your mask carefully so that you don't accidentally yank your hearing aids out when you're taking off your mask. So as I mentioned, mask extenders and hearing aids, they're a great way to get a snug fit without dislodging the hearing aids or the eyeglasses. So different options include using a fabric or a bendable plastic mask extender with buttons or other little notches to attach the mask straps. We give them out here, so you can also find them online, I'm sure, in stores nearby, but we have a bunch, so feel free, if you're a patient of ours, or even if you're not, come in and we'll give you some for free. Using simple tools like plastic S-hooks for the straps, so you can kind of makeshift your own at home if that's what you'd like to do. You can use a cord and clip system, so similar to patients who have glasses who don't want to lose them. Certain hearing aid brands would be Ear Gear or Ear Stay. And then a ponytail or a bun can also be used as a loop anchor. So, fun fact. How to communicate when wearing a mask. Let's go over some tips there. Face masks lower the volume of a person's voice. We know this. They muffle speech clarity. So following these tips, especially when talking to someone with hearing loss to improve communication, will help. I've gone over this with every single one of my patients when they come in, and if I have not, I'm going over it now because it's so important. And actually, a lot of my patients have helped me with this list because that's what they're finding, how they're benefiting the most. So reduce the room's noise if you can. Obviously, you can't reduce a restaurant, but luckily, nowadays less people are going out to restaurants, so they're not as crowded, so it's actually much quieter. But if you can reduce the room's noise and getting the person's attention, that's very helpful before you speak to them. Ask if the person can hear you. You know, it's helpful. Sometimes people want to ignore that they can't hear someone, or they act like they did and they brush it off, but it's not really helpful for anyone. Advocate for yourself and advocate for others who you know may have a hearing loss. Speak slowly and clearly, so not just louder and shouting, but slow and clear enunciation. Don't shout. Make sure hearing aid wearers are using their hearing aids. So many of my patients have come in after a year of being isolated, and unfortunately they really haven't had much social interaction, so they felt like they didn't have to wear their hearing aids or they didn't need to, which I understand, but really constant use of wearing them not only helps reduce auditory deprivation, but it stimulates your auditory nerve, which goes to your brain. So there's a lot of benefits of wearing your hearing aids, even in a quiet environment where you're not around a lot of people, just at home, watching TV, you know, stepping out for coffee or a grocery store. So make sure that you're wearing your hearing aids and that those who need them are wearing theirs. Consider using an assistive listening device, especially if you're in a medical setting or a really important listening environment. And if you would like to know more about different assistive listening devices, please feel free to call or email me, come into the office. We also have a Facebook Live that I did a couple months back about different assistive devices. And for those of you who don't know, those basically are used in conjunction with your hearing aids, like a remote microphone, a TV programmer, a landline phone amplify that can connect with your hearing aids. So there's a lot of devices out there that help in addition to the hearing aid. If you're not understood, try to rephrase what you said with different words rather than just keep repeating the same thing over and over. Take turns while speaking. You know, don't speak over other people. I mean, that's just common courtesy, but it's also very helpful when a patient has a hearing loss. Don't talk while walking away or looking away. You want to face the speaker. A lot of times I have patients who are spouses and maybe they're just so used to each other, they're talking to each other in different rooms, and it doesn't matter if you have the best hearing aid in the world, you're not really going to hear everything that's being said if somebody's in another room, blocking by a wall, or in the kitchen while they're doing the dishes and a bunch of other things. And then if obtainable, clear or transparent masks, such as this one, can help with lip reading and conveying emotions. So speakers often naturally will try to compensate by projecting, but a more effective approach is to just speak more clearly, speak more slowly, with greater enunciation. I've said that before, and I'll just say it again because it deserves repeating. Slower and clearer with more enunciation over louder. Speak up for yourself when talking to strangers, letting them know that you can't hear well and need them to speak more clearly and slowly, because oftentimes they may not be aware. And for the most part, people are empathetic out there and they're willing to help. And if you're the one trying to speak to somebody with a hearing loss, use some creativity to get your meaning conveyed instead of repeating the same misunderstood phrases over and over again. Don't underestimate the power of body language, eye contact, and slowing down speech to be more clear. So there's a visual that I wanted to provide, and I'm going to be posting to the Facebook page, and it basically summarizes everything that we went over today. So just talks about social distancing, face masks, and other changes from the pandemic, and how they make communication harder for all of us, especially for people with hearing loss. So what can be done? So everything that we went over today and then more will be added to our Facebook page. So just a review, talk to your hearing healthcare provider, talk to your audiologist, ask about mask mode, ask about how your hearing aids can be adjusted to help. And with masks and hearing aids, try different modifications. Use a mask holder, fabric ties may work better, removing the mask carefully. We have a lot of extra supplies if needed here, whether that be masks or mask holders, so please don't hesitate to come on in. And be mindful of your communication. Speak slowly, clearly at a normal volume, rephrase remarks when not understood, take turns when speaking, make sure your hearing aids are turned on, make sure that you're wearing your hearing aids, and keep the background noise to a minimum. And if you don't have control over that, try to go in situations that have minimal background noise, and then large noisy restaurants and settings. And then, face each other at a safe distance. I hope all of this was helpful today. And like I said, this video, among many other videos I've done in the past and will do in the future, will be recorded, put on our Facebook wall and on our website, myhearingexpert.com. You can go to our Facebook page, Audio Help Hearing Centers. Find us on Google reviews. We're on Yelp. And feel free to reach out to me personally. I'm Jessica Woodson. I am at the Upper East Side location, 86th and Park Avenue. So if you want to come in, our number is 212-879-3836. Call to schedule an appointment. And if you want to email me personally, I'm very friendly and happy to answer any questions you may have. My email is jwoodson@audiohelp.org. This company has 5 different locations, 3 in Manhattan, and 1 in Scarsdale, and 1 in Stamford, Connecticut. So there are many great audiologists here to help you without the masks, now, in the future, and we hope that you all enjoyed this Facebook Live and feel comfortable coming in to ask any questions to help better improve your hearing. Thanks for joining, everybody, and enjoy the rest of your day. It's a beautiful day out there, so I hope you get out there and enjoy it. So I'm going to go back to seeing my patients, and have a good day. Bye-bye. Oh, thank you, Miss Staker. Thank you, everybody. I'm signing off. If you have any questions, feel free to ask them in the chat here or reaching out to me personally.